My name is Monifa Thomas, and I'm with the Cook County Health and Hospital System. If you need help with an appointment or have a medical question, you can reach our health system by calling 312-864-0200. Again, that's 312-864-0200. My guest tonight is Dr. Lakshmi Warrior, and she is the Associate Medical Director of Stroke at Cook County Health and Hospital System. Welcome to the show.
Thanks so much.
And so May is Stroke Awareness Month. And so because of that, we wanted to talk about the ways that you can educate people about risk factors for stroke and what they can do to prevent having one. Before we get into that though, can you just sort of explain what exactly happens in the brain when someone has a stroke so that people understand that?
Okay, so a stroke is a very common condition. It happens when a blood clot forms in one of the blood vessels that supplies the brain. That blood clot prevents blood from flowing into the brain and prevents oxygen from supplying those brain cells. Without oxygen, those brain cells die and cause the stroke.
Okay, thank you. And then what are some warning factors that people should be aware of if they're concerned, that someone might be having a stroke?
Sure. Because the brain does so much, there are really a variety of different symptoms and signs of stroke. But one easy way to remember it is the acronym FAST, F-A-S-T. F stands for face. So if you're concerned about a stroke and you notice facial droop, or a lopsided smile, that could be something that's concerning. A stands for arm, so arm weakness or arm numbness can also be a sign. S stands for speech difficulty, which can be anything from some slurred speech to difficulty finding your words or inability to speak at all. So those are the real main signs. T stands for time to call 911. If you develop any of these signs or symptoms, it's important to call 911 right away.
Okay. And question for you. So if someone does think they're having a stroke, is it okay if they drive themselves? If so, can you talk a little bit about that?
Yeah, so it's important to call 911 right away because the thing to remember is time is brain. So the quicker you can get to the emergency room, the better. So if you are having signs or symptoms of stroke and are concerned about any of those signs, please call 911. The ambulance drivers are actually trained to bring you to the hospital that can take care of your stroke as quickly as possible.
Okay. And then can you talk about what kind of treatments there are currently for people who have stroke?
Sure. So actually now is a pretty exciting time for stroke. We have a lot of treatments that are coming out, but really all these treatments depend on how quickly you're able to get into the hospital. So one of the best treatments that we have is something called IV Alteplase. It's an intravenous medication that you get through the veins. It's administered at a hospital. This is also known as the clot-busting drug. If this drug is given within 4.5 hours of a stroke, it can break up the clot and prevent the stroke from happening. We also recently have a new treatment called mechanical thrombectomy. That refers to when you actually go into the blood vessel and pull the clot out. We can do mechanical thrombectomy in certain patients up to 24 hours, particularly if there's a blood clot in one of the big blood vessels of the brain.
And then can you talk about some of the known risk factors for strokes?
Sure. So there's a lot of different risk factors for stroke. The most common are probably blood pressure and smoking. But other risk factors include poor diet, lack of exercise, obesity, age. Patients over the age of 70 are more likely to have a stroke. Certain races and ethnicities, as well as women, tend to be more likely to have stroke.
And so, my understanding is that 80% of strokes are preventable. So I was just kind of wondering, what are some things that people can do to prevent strokes?
Yeah, so prevention is really the key to this. Even though we do have these exciting new treatments for stroke when it happens, really prevention is what we really want to focus on. So in order to prevent stroke, you really want to focus on those risk factors. In order to focus on those risk factors, you need to know what your risk factors are. So make sure you go to your primary care doctor and get screened for things like high blood pressure, high cholesterol, diabetes. And if you do develop one of those conditions, make sure you are taking your medications and seeing your doctor regularly.
Sure. And then are there Can you sort of explain a little bit more about what the link is between diabetes and people having a stroke?
Sure. So over time, diabetes can damage the small blood vessels of the brain. When the blood vessels are damaged, it makes it more likely that a blood clot will occur and cause a stroke.
Okay. And then are there other chronic illnesses that people should kind of be aware of that they might lead to stroke or might make you at higher risk?
Yeah, so we mentioned high blood pressure, which is a big one, and diabetes you just mentioned, but high cholesterol is also a big cause of stroke as well.
Okay. And then also going back to high blood pressure, what is sort of like the good, what goal should we be reaching?
Yeah, so recently the American Heart Association came out with new guidelines that we should be more aggressive about our blood pressure control. So a blood pressure less than 130 over 90 is considered good now, whereas before it was even higher than that. The reason for that is we found that when we lower blood pressure, it makes you less likely to develop conditions like stroke. So it's important to be really aggressive about treatment of those of conditions like high blood pressure.
Okay. And then what about, can you speak about some of the other numbers that you should know?
Sure. So in terms of your blood glucose, it's important to have to keep your blood sugars as normal as possible. There's a few numbers we look at for diabetes, and those are the hemoglobin A1C, and we also look at your fasting blood sugar, okay? For cholesterol, it's important to look at your LDL number, okay?
Got it. Okay. And then also my understanding is African Americans are more at risk of having a stroke than other racial groups. And can you, do we know anything about why that is?
Yeah, so that's a very important question that you're asking. We understand part of the reason, and that actually has to do with risk factors. So we know that African Americans tend to have more of these risk factors that put you at increased risk for stroke. For example, when we talk about high blood pressure, that's a big one, especially for African Americans. We call hypertension or high blood pressure a triple threat. African Americans are more likely to have high blood pressure. That high blood pressure is harder to control in African Americans, and if you have high blood pressure as an African American, you're more likely to develop stroke than a Caucasian with high blood pressure. So really, that can be a very difficult thing. So especially if you're African American, it's important to treat these risk factors because that can be a big part of it. But still, even with controlling these risk factors, 50% of the reason for why there's a difference between blacks and whites is still pretty unknown. So there's a lot of things we still don't know, and there's a lot of research and that's going into that.
Got it. And also, you mentioned earlier that women are also at higher risk. And I was just wondering, do we know anything about that? Like, why?
Yeah, so we're not sure exactly why that is. We know that women are at increased risk for stroke, and actually, after a stroke, are more likely to be disabled. We're not exactly sure. Some of them, they do have higher risk of those risk factors, but we don't have a clear idea of exactly why that's happening.
Okay. And then also for people who are hearing this right now, you know, they might think, well, if I'm black or if I'm a woman, that I'm just bound to have a stroke. And can you just talk a little bit more about, you know, why they shouldn't just sort of feel that sense of...
Yeah, no, I mean, the reason why we mention these things is not to bring fear into people. It's just it's to empower you that there are things you can do. A lot of this increased risk has to do with your risk factors, so it's even more important to go to your primary doctor and get those risk factors evaluated and treated right away.
And then also, I'm just wondering, even if you don't have any of the risk factors that we talked about earlier, is it still possible that you might have a stroke?
Absolutely. So there is a certain percentage of patients who develop stroke without known risk factors. When that does occur, we do a pretty extensive workup to look for rarer causes, but even after an extensive workup, there's a certain percentage we don't end up having a clear answer for why that happens.
Okay. And is there any tips that maybe you'd give for just anybody who maybe they don't have any known risk factors that they're aware of, but just sort of things that they should kind of do?
Okay, so the number one thing is to have a relationship with your primary care doctor. See your primary care doctor regularly and get regular screenings for blood pressure and blood sugars, because those are really the biggest risk factors. But if you're a smoker, you should stop smoking. It's important to have a healthy diet with lots of fruits and vegetables, high fiber. It's important to exercise at least 30 minutes a day, 5 days a week. And those things have been shown to prevent stroke.
And then also, is there, because I know this is probably a question that people always want to ask, is just in terms of if they know someone who's had a stroke, is there like an average time for how long it takes to recover from those types of things?
Yeah, so everyone's an individual, and we do see a variety of different times that it takes to improve after a stroke. But we usually say, on average, people tend to improve for about a year following a stroke. The brain's very complicated and it can take a long time to improve. So it's important to be patient. The things that help with improvement, though, are physical therapy, occupational therapy, and speech therapy. Those have been found to be really helpful for improvement. And then, of course, prevention of the next stroke.
Sure. And then can you talk a little bit about like sort of the most common things that lead, or excuse me, if you had a stroke, what are the sort of the common things that people tend to have happen?
You mean the symptoms-wise?
Correct, yes.
Right, so we had talked about facial droop, arm weakness, and then speech. Really, those are really the main signs and symptoms of stroke that I would focus on. Usually it's on one side of the body, and it should occur suddenly. So, but we do know that some people kind of stutter and get a little bit worse over time. So, but I think the main thing to the main take-home message is if you have any symptoms that you're concerned about for stroke that occur suddenly, it's important to call 911 and get to the hospital right away so you can be a candidate for one of these treatments.
Okay. And then if you've had a stroke, what are some of the common things that result in that? So I'm thinking your arms and your legs, maybe you can't use them for they're paralyzed.
Yeah.
Are there other common things?
Right. So, so you can have weakness where you have difficulty moving your arms or legs. You can also have like numbness or loss of sensation. You can have difficulty walking, dizziness, spinning sensation, changes in your vision, double vision, loss of your peripheral vision. So there's really a variety of symptoms. Often after a stroke, even if patients don't develop any of these and improve in a lot of other ways, patients may notice changes in their memory and their thinking, difficulty sleeping, and really depression is a big common symptom that we see following a stroke as well.
Sure. And can you talk a little bit more about that depression? I mean, what do you do if you're finding that person?
Yeah. So depression is a really important secondary effect of stroke. It can really affect patients' qualities of life. So it's really important to get screened for that with your primary care doctor or your neurologist. So you know that we know that the depression occurs not only because it's difficult following a stroke, but also because there's actual chemical changes in the brain. So it's important to get screened for it and then consider treatment. Some of the antidepressants have actually been studied in rehab centers, and they've found that certain antidepressants can actually improve outcomes. These were small studies, but sometimes we do use these antidepressants to not only help with depression, but also help with improvement in strength in some patients. So especially if you develop symptoms like this, it is important to get screened and treated for those things.
Sure. And then just for a caregiver who is treating someone with stroke, is there any advice for those people just to sort of, because I feel like all the focus is obviously on the stroke, and rightly so, but I'm just wondering, for the people that are helping those people, are there any
No,
tips?
absolutely. So it can be really difficult as a caregiver, and sometimes when we discharge a patient from the hospital, we don't recognize how bad their deficit is or how bad their stroke actually is. And when you bring the patient home, you suddenly realize, oh my gosh, they have all of these issues. They're not able to care for themselves the way they were before. So it's important for the caregiver to be plugged into the primary care doctor and be plugged in with a social worker who can possibly give them outlets for different things, different resources we have available for stroke patients. So there's certain home care and homemaker services that are available. Physical therapy and occupational therapy can also be done in the home in certain cases. So there's certain resources that everyone should be aware of and can be helpful, especially in these patients. It is important to ask for help if the caregiver feels overwhelmed, and not just struggle at home by yourself with it, because there are resources that can help in these cases.
Understood. And then also I was just wondering, is there a, sorry, I apologize. Give me 1 second.
Yeah, sure.
Yeah, so you started out just talking about the risk factors that people have. As far as those, are there any other tips that you'd give for how to prevent them, or just sort of things to look for?
I mean, the main thing to do, I think the main message, again, is that time is brain. So if you develop any signs and symptoms, you call 911 right away. So we talked about some of these signs and symptoms being dizziness, numbness, tingling, weakness, vision changes that happen suddenly. So it's important to call 911 right away, so you can be considered for treatment for these things.
Sure.
Yeah.
Okay. And also, just in my own reading, I've heard that sometimes people, when they have a stroke, because they feel that they're very tired, their first impulse is to, go to sleep instead of calling 911. Do you see that a lot in your practice?
Unfortunately, we see it a lot. So often when patients wake up with the symptoms or have gone and taken a nap, like you had mentioned, it can be really difficult because then they aren't actual candidates for the treatment.
Sure. So. Okay. And it looks like we have a caller. Caller, go ahead.
Hi there. I was just wondering if there's support groups for family members of people that have had a stroke.
There are support groups, and we actually have one through Cook County Hospital as well. It should be on our stroke website, which is through the cookcounty.org website. So we have a support group that meets once a month. It's a really important thing to reach out to meet other people with stroke and other people with similar symptoms and similar issues, because there are a lot of resources in the community, like I mentioned, and oftentimes patients are the best people to ask about it. So we do have a support group.
Sure. And another thing that I was reading is that young people seem to be having stroke more often, or at least, not more often than older people, but just that it seems like that's happening more often as far as young people. And I was just wondering, do we know anything about, or are there certain risk factors for that particular age group? Or
Yeah, so actually, we see a pretty young age group with stroke, especially at Cook County Hospital. And the reason for that is actually because we have such a large African American population. About 60% of our stroke patients are African American. We know African Americans tend to have strokes earlier in life, and a lot of that again has to do with these risk factors like high blood pressure and diabetes. So again, even if you're a young person, like in your 20s, 30s, it's important to see a primary care doctor. Even if you feel healthy, you might have high blood pressure, and your first symptom might end up being a stroke. So it's important, even if you're feeling well, to just go to the primary doctor and get screened for diseases like that.
Sure. And anything else that I haven't asked you that you feel people should know as far as stroke education?
I think that's about it, but the most important thing I want to say again is time is brain. So if you develop any signs and symptoms of stroke, it's important to call 911 right away, okay? And if you have a stroke, or you've had a stroke in the past, we'd be happy to see you at the Cook County Stroke Clinic. It's on Wednesday mornings, and we see patients there all the time, so.
Okay, and it looks like we have another caller. Caller, go ahead.
Hi. So I frequently have migraines, and I don't know if it's a risk factor for stroke. I'm just worried. Do you have any advice?
Sure. So migraines can be a risk factor for stroke in certain patients, and some of the medications that are used to treat migraine can also put you at increased risk of stroke. So if you have migraines and you're concerned about this, it's important to see your neurologist right away so you can be evaluated for that.
I didn't know that.
Yeah.
Okay. Are there any other risk factors that maybe people don't know about as much? So like migraine or...
So, so in younger people, migraine is a big one. There's something called a hypercoagulable state where some people, particularly younger people, are more likely to have clotting of their blood. So some of these clotting disorders could put you at increased risk. And then in older patients, there's a condition called atrial fibrillation where you have an irregular heart rhythm. Especially in older patients, this is one of the biggest risk factors for stroke.
And so with the heart condition, I mean, that would be something you'd have to be tested for. So I'm just wondering, how would you know that you have this?
Right. So some people have symptoms of this, like feeling palpitations in their chest, shortness of breath, chest pain. Other people don't recognize that they have it at all. The way you identify it is with an electrocardiogram or an EKG, which your primary doctor can do, or they can do it in the emergency room. So that's how we pick it up, is through the EKG.
Okay.
So,
yeah. And also, I was just wondering, for someone who is having a stroke or has had one recently, is there any like sort of words that you'd give to them? Just because I feel like it's a big adjustment when you've had this happen. So I was just wondering, is there anything that you say to someone who is kind of going through this?
So one thing that I always say to patients is, if there was good news about a stroke, it's that you tend to get better after it. So it's important to know that and to keep working with physical therapy and occupational therapy, and you should see an improvement.
Got it. Okay. Well, I think we've run out of time, but thank you so much for... Oh, excuse me. Actually, we have one more question, one more caller. Caller, go ahead.
Hi, yes. I was asking because the doctor said that if a stroke affects your brain cells, like if after a stroke, it affects your learning abilities.
Yes, so the question was whether it can affect your learning ability, and stroke can. It depends on where the stroke is, but sometimes patients after a stroke can feel like they're having difficulty with their memory and difficulty learning new information. It's important to see your doctor if you are developing symptoms like that, because other things like difficulty with sleep, depression can also contribute to this. So there's a lot of things connected to stroke that can make you feel like you're having trouble with your learning.
Thank you.
You're welcome.
So I'm sorry. So you were saying, as far as, I guess, encouraging things to people who have had a stroke.
Right. So it's important to work really hard with physical therapy, occupational therapy, and speech therapy, because we do see improvement for up to a year. And the harder you work at that, the better. It's hard to know how much better you'll get.
Sure.
But we know that the improvement within the first few months may tell us how well a patient will do eventually. Okay.
Yeah. Okay.
But again, if there's any concern for history of stroke or patients with stroke symptoms, we do have that stroke clinic on Wednesdays. In our stroke clinic, we have a nurse who evaluates all of our patients. Then we have a social worker who screens patients for things like food insecurity, which is a big issue where patients don't have enough availability of fresh fruits and vegetables. And we do have programs that can help patients that have issues like that. We also screen them for things like having issues with transportation, which can make it difficult for patients to make it to the hospital to see their primary care doctors. I see the patient to evaluate for any medical conditions and can prescribe medications depending on what the situation is. Our stroke nurse also sees the patient and talks to them about education about stroke and what we can do to prevent it. And then we also have a smoking cessation advocate who can help patients stop smoking, because that's one of the biggest risk factors for stroke, and it's a really important thing that you can make a difference with. So, yes.
All right.
All right.
Well, our time has run out, but thank you so much for taking the time to talk to us, and thank you viewers for watching.
Yeah, thank you.